Sleep is the bedrock of our health. It's the tide which floats all boats and fundamentally important. If you think about it, we spend about a third of our lives in this unconscious, effectively paralyzed and vulnerable state. So something really important must be going on if this happens to us throughout our lives. And we know that in sleep there's a process of healing, repair and restoration. We consolidate learning and memories. The glial cells in our brains shrink and the cerebrospinal fluid flows more freely between them, clearing away the physical debris of the day. And as well as knowing that sleep is really important for us, the flip side is also clear that deprivation, the lack of sleep, is really bad for us and has been clearly linked to all sorts of health problems, including cardiovascular disease, hypertension, mental health problems, dementia, and even cancer. And the problem is that on average, we probably need about 7 to 8 hours sleep. But over the last 50 to 100 years, because of the way that our society has changed, we're depriving ourselves of it. The amount of light pollution, our working patterns, our 24/7 culture, all of these things can contribute. In fact, the CEO of Netflix was once asked who the biggest competitor to Netflix was, and he replied, sleep. So here are my top tips for getting a good night's sleep. First of all, I recommend a regular routine in terms of the time that you get up and the time that you go to bed. Your circadian rhythm means that your body clock works on a roughly 24-hour basis, and the more you can do to have a regular rhythm, the better for you. Part of that is physical activity as well. If you get up in the morning and you get outside, get the sunlight on your face and the physical exercise, the fresh air, that ticks lots of boxes in terms of well-being, and it also helps to anchor that rhythm. One of the drawbacks of physical activity much later on in the day, in the evening for example, is that actually it tends to send your body the wrong message and can make it a bit harder to get to sleep. Your bedtime routine is really important as well. Sleep shouldn't be something that we just launch into like something else on the to-do list. It needs proper preparation. So having a good winding down routine is key. Try not to have any screens on your phone, tablet or laptop for at least an hour or two before bedtime, because the blue-white light that comes from those screens disrupts our levels of melatonin, which helps us get to sleep. And winding down is a really important part of that as well. Have low lights, relaxing music, a warm milky drink or a nice warm bath, things which generally help to prepare you for sleep rather than getting your brain worked up. Most chemicals also interfere with sleep. Caffeine's a particular one. So caffeine has a half-life of 6 hours, which means that if you have a cup of coffee at 12 o'clock, half of it's still in your system at 6 and a quarter of it's still in there at midnight. And depending on how sensitive you are to caffeine, that can really disrupt your sleep. So I do recommend to people who struggle with their sleep to have their last cup of coffee by midday. Smoking has also been shown to cause lots of health problems, and one of which is disruption to your sleep with the nicotine that you get in there. So obviously there are lots of reasons why quitting smoking is good for you, and that's one of them. Alcohol is another common issue too. A lot of people, particularly in these times, will talk about how maybe they find it helpful to have a drink to get them off to sleep at bedtime. And it is true that alcohol is a sedative, but unfortunately it's not restorative. And there's good objective data looking at people when they're asleep to show that if you drink before bedtime, it does result in you having a poorer quality of sleep. So again, I recommend either not drinking in the evening or making your last drink, at least a couple of hours before you're thinking about going to sleep. Mobile phones I've already touched upon in terms of screens and blue-white light. But there's also another reason why it's worth thinking about turning these things off, because it's all about giving yourself permission to unwind and relax. And it's not just about the light, it's about the fact that you're checking emails or disappearing down the rabbit hole of social media. And most of these things are generally, if not upsetting or stressful, then they are things which turn our brain on and give it the wrong messages as we're trying to get to sleep. In terms of your bedroom environment, if at all possible, your bedroom should be a cool, dark place. And also, if you can, depending on your living arrangements, make the bedroom a place that is a place for sleep, not also your study, your lounge, etc. And one of the reasons that people often struggle with their sleep is, of course, that they may be suffering from mental health concerns, and disturbed sleep is one of the symptoms of mental health problems. And I do appreciate that not everyone who has disturbed sleep because they haven't got very good sleep hygiene. They might have disturbed sleep because of the things that are going on in their lives. being able to talk to other people honestly and openly about your mental health, whether it's a friend, a family member, or a doctor or nurse, can help you as you start to improve your mental health. And one of the consequences of that will eventually be better sleep.